Republican from New Jersey. That's my home state, full disclosure. Despite the accent, yes, I've lived in New Jersey for the past 30 years. I have to put that right up front. Congressman, thanks for joining us. We appreciate you being with us, sir.
Thank you for having me, Stuart.
I have to say, having lived in New Jersey for the best part of 30 years, it is one of the bluest of blue states. And many of us were shocked when Chris Christie was elected governor in November of last year. But nonetheless, it is a blue state. And you are proposing to vote no on a central issue for blue state people, which is health care reform. How do you think your constituents are going to react when you come back with a no vote on this thing?
My constituents are overwhelmingly opposed to this proposal. We all favor health care reform, Stuart, but this is not real health care reform. $500 billion taken out of Medicare, $500 billion in new taxes, and as you know, New Jersey is a state with extremely high taxes already, and of course, no medical malpractice insurance reform. These are the issues we should be addressing.
I've asked everybody on the program so far, what is it that you dislike most about the health care reform bill that's before Congress this afternoon? What's the single issue you dislike most?
I dislike most the fact that the majority refused to take our views into consideration. And, for example, medical malpractice insurance reform is essential moving forward. And as your guest recently said, we have a terrible problem regarding debt and annual deficits in this country, and this will make that situation much worse. This does not pay for itself. The CBO estimates do not include the fact that we will compensate doctors, and there has to be a doctor fix regarding this bill, and that will cost another $200 billion or more. And so we have to move forward responsibly in a fiscal manner, and that is what I dislike most about this bill.
You're right there in the middle of it all. Do you think that it's going to pass? As of right now, do you think it would pass?
I do not think it would pass this afternoon. I do not think the Democratic majority has the votes. I'm sure arms are being twisted as you and I are speaking, but if the vote were to occur this instant, I do not believe there are 216 votes for the package.
But that belies the question. Why would they start the whole voting process? And they have started. Why would they do that if they haven't got the votes?
I believe that they think that if they get close to 216, there will be enormous pressure on wavering members on the floor this evening, and I would hope that all of my colleagues who have grave concerns about this bill will stay firm. We can do a better job, and we want to work with our Democratic colleagues, but this is not the bill that should become law.
Clearly, a no vote. Leonard Lance, Republican, New Jersey. Thanks for joining us, sir. Time is limited. Thanks for joining us, sir.